Hello everyone and welcome to Health Trust TV. I'm your host Adam Morella. Have you been to the doctor lately? If not, today you'll learn why it's important to see a doctor regularly. But first, we're delighted to have Paul Hepfer, Vice President of Programs and Director of Healthy Living at the Health Trust. He's here to tell us how to enroll in health insurance with Covered California. Hello Paul, and thank you for being with us today.
Thanks Adam, glad to be here.
Good. So Paul, how long have you been with the Health Trust and what's your primary role?
I've been with the Health Trust about 8 years now, and in my role as Vice President of Programs, I have the opportunity to oversee all of our program managers and directors of our various direct service programs like our HIV/AIDS program, our Meals on Wheels program, our Wellness Access and Education program, disease management, and our health insurance enrollment program.
That's great. So what kind of services does the Health Trust provide for people that are looking to sign up for health insurance?
For a number of years, over 10 years, we've been helping children and families with young children enroll in Healthy Family and Healthy Kids. Mm-hmm. Over the years, we've probably enrolled almost 100,000 children in Santa Clara County. And more recently, since the passage of the Affordable Care Act, we were now able to enroll adults also along with their children into Medi-Cal, expanded Medi-Cal, and the other services within Covered California.
Mm-hmm. So with the passage of Obamacare, there's so many questions. I have a list of them here for you. So first off, how do you sign up for the new Covered California? How does it work? What does the process look like? How long does it take to enroll? How long does it take to receive insurance after enrollment? Once insured, how do you select your doctor, and can I keep my old doctor?
Those are a lot of great questions and a lot of similar questions that everyone in the country has. A few quick answers for that.
Sure.
First of all, the Covered California website tries to answer most of those questions for you. So if you're really familiar with the internet and you're comfortable using it, you can go online and look at their frequently asked questions, and those are most of them.
Okay.
More specifically, if you have some troubles with the website, or if you really want to talk to a person, you can contact one of our enrollers at the Health Trust and set up an appointment, and they can really walk through the process with you.
Okay.
The average application will probably take a little more than an hour, maybe 2 hours if you have, kind of a complicated application or a lot of questions. But our enrollers are used to working with people on a one-on-one basis, and they'll take the time to really help you figure it out.
That's great. So how does someone contact the Health Trust to enroll?
If you go to the Health Trust website, we have a link to get enrolled in Covered California. You click on that link, and our phone number there, you can call and make an appointment with one of our enrollers. We have enrollers that are proficient in several different languages, and we have ways to make sure we can get an appointment for you.
And another quick question, if I have a current doctor, can I keep my old doctor as I move into new health insurance?
Most likely, yes.
Okay.
There's a few situations that people are finding where there might be some changes, but again, that's something when you're selecting a plan or your coverage, you'll be able to figure that out as you're going through the application.
Okay, and how long does it take for me to receive that insurance after I enroll?
It can be several weeks, up to 3-4 weeks in some cases. Some people are eligible for coverage almost immediately. Kind of depends on what situation you're in, but your application assister, your certified counselor will be able to help you, and you'll know when you leave there how much time to expect before you get notification of enrollment.
Okay, Paul, that's all really important information that we all really need to understand, so thank you so much for coming in today. And now we'll send you to Paloma with a field interview.
Thank you, Adam. And on today's show, I have the pleasure of being with Dr. Kriegsman from Valley Homeless Healthcare Program. Thank you for being with us, Dr. Kriegsman.
Happy to be here.
Can you tell us a little bit about the program?
Yeah, well, our motto is we call ourselves the safety net for the safety net. And so we tried our best to kind of reach out and find the homeless people to provide them with the health care that it's really hard for them to find in other avenues.
So how many doctors are involved in this program?
Yeah, so right now we have 5 doctors and 2 nurse practitioners. And we have 2 full-time clinics. And we also have this mobile medical unit that you see behind you that goes throughout the county to try to find, again, our most vulnerable patients that we have.
How many different encampments do you visit, and how often do you visit them?
Over the past year, we've probably visited about 10 or 15 encampments. The city conducts sweeps periodically, and so the encampments are constantly shifting. But throughout the year, we've visited probably 10 to 15 different encampments. The mobile van goes to different sites throughout the county. So Tuesdays we're here, and then Wednesdays with the Reentry Center downtown, and Thursdays in Gilroy, and Mondays in the Sunnyvale Armory. And so pretty much every day of the week you can find us somewhere in the county. trying to find the people who need the health care.
That's wonderful. And what kind of medical resources do you have at your disposal to treat patients at these encampments?
So we do a couple of different things. On the bus itself, it functions almost as a regular clinic. We have a Wi-Fi, so we actually hook up to electronic medical record of our hospital. And so I can prescribe medicines directly to the biomedical center pharmacies throughout San Jose. And it functions mostly as a clinic, so many of the same things that you could get in a doctor's visit to a regular clinic you can do here. I can do small procedures, I can do gynecological exams. We have a refrigerator, we keep medicines, so we can give medicines, we can give vaccines here. And kind of a unique program that we have is we actually have a fair amount of medicines on site. And the idea being in taking care of homeless people, the kind of barriers that most people can cross quite easily to get their health care, being calling your doctor, making it to a visit, making it to the pharmacy to pick up your prescription. These things get a lot harder for homeless people, and so we have a program here where we actually have medicines on board that we can give to people the same day that they're visiting, so we ensure that they actually get the treatment.
That's wonderful. And about how many patients would you say your organization treats annually?
I think we do something on the order of 7,000 or 8,000 visits a year.
And what type of illnesses do you see and treat?
There are some diseases that tend to cluster in the homeless population. Certain infectious diseases like HIV and hepatitis C and sexually transmitted diseases. So we definitely see a fair share of that. But mostly, I guess there's a couple other, mostly I think what we see is just normal diseases that you or I would get or anyone would get that are just way out of control. So if it's congestive heart failure or diabetes, and most people are able to see a doctor for regularly and have good access to their medicines. Here we have people that go for a long time without their medications and then actually just showing up much, much sicker with it. So it might just be a simple skin infection that we can take care of by keeping ourselves clean. People who live outside can't do that. And then they can't make it to see a doctor, so we see them a couple of weeks later when they have a raging infection that could have been caught at an earlier stage. And I think the more that we're here, we're able to kind of treat those things earlier on and prevent them having to go to the emergency room when they get much later. And I think another unique part of our program that we have here is any homeless population you have, you're going to see a lot of psychological, psychiatric, and mental illness and substance abuse problems. And so we actually have a psychologist who comes out with me every Tuesday morning, Dr. Preston, and so we can actually help address some of those issues out here. And I do a close consultation with the psychiatrists in our program, so we can actually prescribe psychiatric medications short term to people to help get them stabilized and in a place where they can take care of the rest of their health.
That's wonderful. How does this program receive its funding?
A couple of different streams, primarily through the county. So I'm an employee of the county and Valley Medical Center. So thankfully, we've been really well funded by the county. We also get federal funding from the Healthcare for the Homeless, a grant through there.
Well, thank you so much for being with us today.
Thanks for having us.
And now I'll send it over to Elena for a Healthy Choice segment.